Breakthrough: chronic inflammation in pregnancy linked to childhood neurodevelopmental delays. I'm Steve Belair. Welcome to Breakthroughs. In pregnant women, obesity, diabetes, hypertension, depression, and anxiety can increase the chances of learning delays, behavioral problems, and mental health issues in their children's early years. A new study reported in the journal Biological Psychiatry, published by Elsevier, strengthens the evidence that chronic low-grade inflammation common to these maternal conditions may be partly to blame for the higher risk of childhood neurodevelopmental delays. Researchers have long suspected chronic maternal inflammation may play a role in altering neurodevelopmental trajectories, leading to adverse childhood outcomes. Earlier studies involving animals have implicated maternal inflammation as a mechanism causing neurodevelopmental delays in offspring. Our findings suggest a potential therapeutic strategy to reduce prenatal exposure to inflammation and improve childhood neurodevelopment outcomes, said first author Polina Gurchenko. To investigate further, Dr. Gurchenko and her colleagues analyzed data from 418 pregnant women and their children aged between 7 to 11 years old in southern and eastern Finland. The women's data came from a study called PREDO, which is designed to predict and prevent preeclampsia during pregnancy. So there was a large prevalence of risk factors including obesity, gestational diabetes, and hypertension. The team evaluated 2 maternal inflammatory biomarkers taken at 3 time points in the pregnancy. Maternal depression and anxiety diagnoses were extracted from Finland's National Health Registry. For the children, the research team cast a wider net, using medical records and mothers' reports. Developmental delays were defined based on maternal reports and diagnoses extracted from Finland's National Medical Registry and included delays in cognitive, motor, and social development. Results revealed that prenatal exposure to at least one of the maternal metabolic conditions or mental health adversities was associated with a 2-fold higher risk factor of more areas of childhood neurodevelopmental delays and was also linked to persistently high levels of antenatal inflammation. Prenatal exposure to higher levels of 2 maternal inflammatory biomarkers also increased the child's risk of neurodevelopmental delays. The 2 biomarkers combined predicted childhood neurodevelopmental delay more precisely than one alone. This study highlights that some potentially modifiable prenatal factors may increase the negative impact of adverse environments upon the brain and behavior during childhood, said John Crystal. Dr. Gurchenko added, "For women who are at risk, we think that antenatal intervention may provide targeted prevention, such as dietary supplements associated with reduced inflammation. It's an avenue for future studies to determine the most effective interventions. At this stage, we've opened the door for further discoveries in the field." Wow! I'll leave a link to the full article in the description, and as usual, please like, share, subscribe, and take care.